Doctor, low glycemic index foods are good for people with diabetes, right? This is a question I get asked often. What do you think of this very common perception amongst many people that low GI food equals food that's good for people with diabetes? This is what I want to tackle in this video. Whether low GI food would always necessarily equal to food that are good for people with diabetes. If you're interested, watch on. Hi, I'm Dr. Chan. I am a medical doctor from Singapore on a mission to encourage people to unlock the tremendous power of healthy lifestyle and eating habits in combating diabetes and other lifestyle-related chronic diseases. Low GI food equals good for diabetes. True or false? My answer: it is unhelpful and sometimes even somewhat misleading to oversimplistically equate all low GI categorized or low GI labeled food to be always and clearly good for every person with diabetes. Especially when the degree of severity of the underlying diabetes condition and the degree of the problem with blood glucose control are not the same for every person with diabetes, but can vary very widely. Let me explain. Firstly, managing and combating diabetes holistically and successfully is more than just about achieving good blood sugar control. A person with diabetes must do a lot more than just try to eat in a way to avoid unhealthy sugar spikes after meals. A diet that's truly good for people with diabetes must also help to tackle the pathophysiologies of diabetes, as well as help prevent and combat the many complications of diabetes. I will not be covering this in this video. I have a video in my series on diabetes where I listed out and spoke at length the 5 criteria that a truly good diet for diabetes must fulfill. Suggest that you watch that after this video, link in the description. A low GI categorized or low GI labeled food only ticks box number 1 in this list of 5 important criteria that makes a good diet for people with diabetes. For instance, there are many low GI foods that may help minimize sugar spikes, but may also be clearly not good for long-term health or in reducing the risk of diabetes complications in the future. So this is reason number 1. Why I would say that it may not be always correct to say that low GI food equals food that is good for people with diabetes. Because managing diabetes optimally is more than just about achieving good blood glucose control. Reason number 2, low GI food may not necessarily always translate to no or low blood glucose spikes for everybody, especially for people with diabetes. So it is unhelpful to oversimplistically tell people with diabetes that all low GI categorized or low GI labeled food as being good for them. Telling them that low GI food as food that will definitely not spike their blood glucose. That would not only be incorrect, it will also be unhelpful. I have a video where I explain this in great detail on why low GI may not necessarily mean low sugar spike. Suggest that you watch that video after this if you have not already done so. So these are the 2 reasons why it is unhelpful to oversimplistically equate all low GI categorized or low GI labeled food to be always and unquestionably good for every person with diabetes. At this point, you might be asking, Doctor, are you saying that glycemic index or GI is useless? No, I'm not saying that. Because despite its limitations, glycemic index or GI, if used correctly, can still be helpful for people with diabetes to help them make better food choices. The key word here is when used correctly. So that's what I shall cover next, the correct and also incorrect use of GI to guide food choices. Let's start with how we should not be using GI. We cannot expect to use GI to accurately predict a person's glycemic response to a food or a meal, not even a low GI one. Let me illustrate what I mean. If I give a person with diabetes a combination meal that includes some amount of low GI carbohydrate containing ingredients, for example, a bowl of low GI rice with some meats and vegetables, would I be able to confidently predict that this person's blood glucose would not spike to unhealthy levels after consumption, just because the carbohydrate containing ingredient in the meal is low GI? The answer is no. Because the glycemic response of a person is dependent on more than just the GI of the carbohydrate containing component in the meal. but it's also affected by many other meal-related factors, such as the amount of the method of preparation of the carbohydrate-containing ingredients in the meal, how that is combined with meats and vegetables, as well as the person's level of insulin production and insulin sensitivity. For more details on this, check out the video I mentioned earlier. Just because the rice used in this meal is low GI rice, there is still no way to predict whether the post-meal blood sugar spike of a person, especially a person with diabetes, after eating this meal will be okay, borderline, or unhealthily high. So if we cannot use GI to confidently predict actual glycemic response, what can we use GI for? We can use GI to achieve better relative glycemic response, even though we cannot use it to predict actual glycemic response. This can be achieved when we directly substitute the carbohydrate containing component in a meal with lower GI equivalent. What do I mean? Let's say your original intention was to have this meal consisting of some high GI white rice with some vegetables and meats. Then, if you directly substitute the high GI white rice with low GI rice, then we can confidently say that your glycemic response to the meal with the same amount of low GI rice cooked in the same way will likely be lower than if you have had the same exact meal with the higher GI white rice. But it needs to be direct, exact substitution before we can be confident that it will be so. We cannot predict that your glycemic response will be lower if we had replaced the higher GI white rice with a different amount of the low GI rice, or replace the higher GI white rice with the same amount of the low GI rice but which has been cooked differently, or if we had replaced the higher GI white rice with the same amount of lower GI rice cooked in the same way but combined differently with meats and vegetables. Therefore, we can only confidently predict that you will get a lower relative glycemic response only if you have done direct substitution. That is, substituting the high GI carbohydrates containing components in the meal with the exact amount of lower GI equivalent ingredients cooked in the same way and combined in the same proportion with meats and vegetables. For example, if you are cooking at home, you can switch the high GI components in your recipes with lower GI equivalents using the exact same recipe, not changing any parts of the recipe, including the quantities of the ingredients and cooking methods or time. In conclusion, to recap what I have covered in this video, it is not correct nor helpful to oversimplistically equate all low GI categorized or low GI labeled food to be always and clearly good for every person with diabetes. Because 1. Managing diabetes optimally requires more than just aiming for good blood glucose control. And 2. Glycemic response to food, even if they are low GI food, can vary widely, especially for people with diabetes. And although it is incorrect to use GI to predict actual glycemic response of a person to a food, we can still use GI to help people, especially those with diabetes, make better food choices by making a direct swap, a direct substitution of the high GI carbohydrates containing component in a meal or recipe with a lower GI equivalent in the way that I described earlier. I hope you have found this video useful. Thank you for watching. I am Dr. Chan. Let habits be diet medicine. Let's unlock the power of healthy lifestyle and dietary habits as medicine. One dose, one habit at a time.